So my name's Samira Afzal. And I basically studied medicine at the University of Cambridge, graduated at 2012. Since then, worked at Cambridge, London, Birmingham, and alhamdulillah, I've just finished my specialty training in infectious diseases and microbiology last week, 2 weeks ago. And inshallah, I'll be starting as a consultant infectious diseases and microbiology post in September, so please do remember me now, your duas. And these are slides contributed by Dr. Adil Riaz, who's one of our very dear colleagues at British Islamic Medical Association. And really, the idea of this is to try and whiz through a bit of what BIMA does, a bit of what our current COVID status is, very quickly touch on current vaccination, and then focus on Q&A. So BIMA thoughts is basically a professional association, British Muslim professionals. It's purely voluntary. A lot of work is done with local mosques and communities, and health promotion is one of the many things which BIMA does. That includes organizing campaigns against acid and chemical attacks, mental health, CPR training, cancer screening, and of course, since COVID started, a lot of work done to promote COVID vaccination and COVID awareness. So back in January, as we know, things were not so good. So 1,600 a day. Currently, alhamdulillah, things have improved. So at the moment, daily, it's about 37,000 people testing positive, but the number of, which isn't too different from before. But what's changed quite markedly, even in my experience, is the number of deaths. So at its peak, there were about 1,600, 1,400, certainly working at Heartlands Hospital. I remember sometimes sending up to 6, 8 people to ICU per day. And sadly, being there doing the last phone calls for about 4 people dying per day on just 2 wards. And alhamdulillah, now things are much better. So this is a little graph just to show you that in January, of course, we were peaking quite a bit. And now you can see that in July, things went down, then lockdown was lifted a little bit, another little peak, and then alhamdulillah, things are settling. The number of deaths, however, despite this peak, has not been very high. Over here, obviously, clear overlap. But in July, the number of cases increased, but alhamdulillah, the number of deaths, not so much. And there are multiple reasons why this happened. Firstly, alhamdulillah, lockdown. Second, the vaccination drive helped tremendously as well. So Walsall, which is our area, daily about 148, 150 test positive. So that's a rate of about 320 as of 19th August per 100,000 people. The England average is around 343. That's within 28 days of positive tests. In the last 7 days, there have been 6, averaging about 1 per day. And then there are about 4 hospital admissions per day. In terms of Walsall's doing in terms of vaccination, slightly lower than UK average. So UK average percentage above 16 years old who've had their first dose is 87.4%. Walsall's around 79.8%. And then, of course, second dose 76 and 69%. And in terms of the actual cases, so huge area, Walsall around here, it hovers around the higher end of this. So it's around 300 plus for Walsall. And of course, there's some areas where it's a bit higher. So COVID-19, again, we know this already. We're not going to spend too much time on this. The key issue which many people raise and are very worried about are the variants. So classically, it's been the Alpha variant within the UK. And like all viruses, COVID also mutates. And although the mutation rate is a bit slower compared to other viruses, and we are hoping that that would be the eventual downfall of COVID-19, fact is that the new variants coming out are more transmissible. So right now there's the Delta variant going on. We've had Lambda, etc. in the interim as well. And a key thing with these variants, apart from increased transmissibility, is how effective the vaccines are against them. So we'll visit that data in a bit. Just wanted to share a little bit about the COVID-19 patient's journey in hospital, because many people have actually asked me, what with families not being allowed to visit, what actually happens, and if there's any treatment. Now, nothing is 100% curative. When people come in with COVID-19 in hospital and require oxygen, we end up giving high dose of steroids, usually by tablet, if they're still able to swallow. And then there is an antibody type drug called tocilizumab, which might work, evidenced by some trials, but no one knows 100% for sure. And really, mainstay is giving more and more oxygen. And sometimes when the maximum amount of oxygen is still not enough, people with COVID tend to get oxygen via a special machine called the CPAP machine, which some of you may be familiar with. And this is a machine which forces air down the lungs. So it's strapped onto the person's face quite tightly, and the nurses will try their utmost, very best to avoid these tight seal causing pressure sores like this. But as you can imagine, the priority is always to keep the person's lungs working and keep everyone alive and avoid intubation, which is what's happening to this gentleman here. So there was a time, certainly in Birmingham ICU, when we'll go in and all around we'll just hear Quran, because it was filled with Muslims, ethnic minorities, not least due to health inequalities. As we know, COVID disproportionately affects Black and Asian minorities. And there are other risk factors such as obesity, diabetes, poorly controlled, which is associated with a higher risk of bad outcome from COVID. Generally, even with intubation, should intubation be successful, there's still a lot of psychological trauma which patients tend to feel, despite being sedated. Actually, to a certain extent, subconsciously, the person can listen a bit as to what's going on. And often there's a lot of trauma associated psychologically as well as physically with long stays in ICU. Post-COVID, there's also something which we call post-COVID lung, which is basically lung fibrosis, hardening of the lung after COVID has come and gone even. So a person still remains breathless for a very long time. So moving forward, this was a time when the cemeteries at Birmingham got full. Now, the key thing with ongoing COVID is that the patient group is getting younger. So back in January, it was noticed this trend was realized when there was a spike in the 45 to 64-year-olds. And this is the latest data as of 20th August from the Critical Care Association in England. And as you can see, males are more affected, and also several patients, more patients are between 40 to 69 years old. So this gray bits here, and likewise for women as well. And certainly in my experience, this is very much the case, especially in West Midlands. And what's frightening from this time is that there are more pregnant women percentage compared to before. So COVID-19 and pregnancy itself, more than half of pregnant women who actually have positive COVID results tend to be asymptomatic. And there's no real increase in stillbirth or neonatal death. And even of the babies born, less than 2% of babies born to COVID positive mothers, less than 2% tend to have COVID, and usually the baby's fine. What does happen is that if a pregnant lady in her 3rd trimester, so as you can imagine, really big tummy, very big, a baby's big as well, baby in tummy is squishing the lungs already, then squished lungs with COVID are even harder to breathe with. And ultimately, in the 3rd trimester, if mom gets COVID, it tends to be a bit more severe. And in which case then, to improve the chances of mother getting better, the doctors tend to make the very difficult call of perhaps having a C-section, so operating earlier to get the baby out. So we start giving medicines like steroids for the baby to mature a bit faster. Often we try and delay delivery as much as we can, but obviously we need to make sure that we need to try and keep mom alive as well. So it ends up being a difficult decision between mom, dad, the obstetrics doctor, the anesthetist, infectious diseases, about now is the time when baby's really big, mom's really deteriorating, we need to get the baby out, even though it's not yet time for baby to come out. So there's an increased risk of preterm birth. And pregnant women tend to be more likely to have severe COVID if they're overweight, as we know, minority backgrounds, comorbidities, or a bit older. Now, worldwide data has shown that pregnant women who are severely affected by COVID are more likely to be admitted to ICU compared to non-pregnant women of the same age. And the UK data, certainly, and from my experience this time around as well, about 1 in 5 in prime reproductive age are currently pregnant. So if a woman is between 16 and 49 years old in ICU, we can say 1 in 5 chance that she's pregnant. And being recently pregnant, that is within 6 weeks of delivery, is also a risk of being bad enough to require ICU admission. So this is the proportion of pregnant females in ICU has increased compared to September 2020 and April 2020. So back then, right until April this year, about 7.4% were pregnant. Now it's about 17.8%. Though you can see that the total number of people in ICU has actually decreased. So we already know this, COVID-19 is a killer. There's lots of fake news around. And ultimately, you are in control of your choices and your decisions. So COVID-19 vaccination, I was pretty much one of the first people to receive the Pfizer vaccine when it was being rolled out, on the basis that I have had, on the basis of the job really. So my job at that point involved seeing everyone with COVID, at times often trying to help with the oxygenation levels. Everyone was coughing all over me and the nurses. And right at the very beginning of COVID, around March, April last year, I actually had COVID-19 infection. So about 10 months down the line, January 2021, when Pfizer was being offered, and I was given the chance, I quite jumped onto it. My rationale being that even if I have had COVID-19 before, I don't know how long my antibodies would have lasted. So that was my reason for going for COVID-19 vaccination. And at that time, when I was explaining it to my parents, I felt as if I was being thrown out of a plane and someone was giving me a parachute, I'd take it. So to me, the way I explained it to my mom was, it was as if I was taking a parachute as such. And really, the thing with COVID-19 vaccination when it first came out was, we're told that it does not necessarily prevent COVID-19 infection. No, it's the PPE, the hand hygiene, the washing hands, which we do, the masks, which prevent it. The rationale behind the vaccines when they were originally trialed was to prevent severe COVID-19 infection. The British Islamic Medical Association has worked with several religious scholars to issue statements on the halalness of this. And of the 3 vaccines currently offered in the UK, AstraZeneca, Pfizer, and Moderna, there are summary statements supporting the use of these vaccinations in Muslims, recommending it, which you can find on the BMO website. So currently, the COVID-19 vaccines in the UK are Pfizer, Oxford AstraZeneca, and Moderna. So the Pfizer vaccine is an mRNA vaccine. So mRNA is basically the stuff which is translated from our DNA. And the Pfizer mRNA vaccine, once injected, tends to degrade itself after a few days anyway. There were 44,000 people in the trial, and usually in these trials, they divide them into 2 groups. And one group received 2 doses of about which turned out to be about 95% effective in preventing symptomatic COVID. In the trial, 2 people had anaphylaxis, and these were people who were known to have had anaphylaxis to unknown substances before. So anaphylaxis, for those who were asking, it's basically swelling of the face and tongue, wheeziness, which can affect breathing and at times lead to death. So far, of the Pfizer cases which I have been involved in delivering, not seen one, and now mostly there's loads of other options available anyway for those who have gotten a history of anaphylaxis before. So the other option is Oxford AstraZeneca. So this is basically an adenovirus vector vaccine. So basically there's another virus, an animal virus, which has been weakened, and it's used to carry the component of the weakened COVID envelope, so it can't actually cause COVID, into the body. There were 11,000 plus people in the trial, and 2 doses were about 70% effective. There was 1 case of nerve problem, possibly, and no anaphylaxis. However, sometime around last year, we started seeing people, young people mostly, aged below 40. Certainly the ones I had were below 30, between 20 to 32. And there was an incident of weird clotting. So there is a thought that the Oxford vaccine is associated with a rare side effect called cerebral venous sinus thrombosis, and that's basically clot in the brain. So far, 15 cases per million after the first dose, and it usually happens between 5 to 16 days after vaccination. So generally, the recommendation is for the younger people, they try and avoid Oxford AstraZeneca. That said, my husband, who's 33, had his Oxford AstraZeneca vaccine, as did my brother, who's 29, and alhamdulillah, no problems whatsoever. So our family's rationale for that was the risk of dying from COVID is far higher than the risk of getting a clot, and that's why they went for it. Then the third option, of course, is the Moderna vaccine, which is similar type to the Pfizer vaccine. There were about 30,000 volunteers, about 94% efficacy, and this is all based on trials. In the real world now, we've got data coming out about the vaccine effectiveness, and this is from Public Health England. A single dose of either Pfizer or AstraZeneca give about 60% protection against symptomatic disease. This basically means that you can still get COVID, but you won't be symptomatic from it. And the vaccinated cases are also around 40% less likely to need hospital admission. Certainly from my experience working in A&E so far, a key thing which we always ask is, have you had your vaccines? Many people say no. And of those who say yes, it is possible that they've only had, usually they've had the vaccine less than 14 days before becoming ill, or they were already ill when they had the vaccine. Bear in mind that the vaccine takes about 2 weeks to kick in. So in the first 14 days, it is still possible to get COVID and have had COVID. I will be upfront and honest that I have certainly seen people who've had 2 doses of COVID vaccine come in with COVID. But the good news is, alhamdulillah, that they often don't need much oxygen, even if they need to be in hospital. After 2-3 days and a little bit of oxygen, they are all right and they go home, compared to those who have not had the vaccine. As the studies showed, as the real world data showed, those without the vaccine tend to have more severe COVID and require more ICU admission. So the latest worry now is the Delta variant, which is more transmissible. And the question was, does the vaccine work against the Delta variant? So only this last week, there's been studies published saying that the vaccines are still effective against the Delta variant, but it is slightly lower for the Delta variant compared to the Alpha one, especially if you've only had 1 dose. And remember, the Alpha variant was the original COVID one. And according to PHE studies, protection against hospitalization is maintained after 2 doses of it. So of course, then there was the vaccination drive. We all know this. At the moment, even young people less than 50 years old, I think above 20 are being offered the vaccine now, especially in West Midlands area. I'd just like to draw your attention that even at the very beginning, pregnant women, as said here, were considered a high-risk group and therefore were given priority to receive vaccines. And quite a few of my doctor friends, including ear, nose and throat specialists, who were pregnant, went ahead, had it, and alhamdulillah, no real issues. These are, and just a little bit to share my experience of it. So this time around, how are we doing with regards to vaccination of pregnant women? Since the time my pregnant friends had the vaccine, there has been increase in confidence. More pregnant women are getting vaccinated. And it is thought that the vaccination program has prevented 82,000 hospitalizations in those above age 65. And modeling data suggests that it probably has prevented 95,000 deaths. Now, the thing with interventions such as vaccine is that it has to be measured by modeling as opposed to real world. Obviously, however, the drop in the graphs which you saw earlier, that despite a higher number of cases, the number of deaths is lower, does support the thought that vaccination has helped prevent deaths because of COVID. So these are just some cards we shared from our previous one. I have had my second one as well, even though it's not signed. How to get vaccinated? I think everyone knows this already. There are walk-in centers, GP invites. Of course, there are a few myths, and I'm more than happy to go through these in the Q&A sessions. And on the BIMA website, if you type BIMA vaccination, there'll also be good information cards about this. So the one which I'd like to draw your attention to is this: GPs making lots of money from COVID vaccinations. The truth is that, no, it's $12.50. If anything, they're barely breaking even, considering the amount they have to pay the staff, the electricity, the transport of it, and the administration and the monitoring after that. So it's not a profit generating exercise. So vaccines are unsafe. That is why no pregnant women were in the trials. Not strictly true, as anyone who's been pregnant before or ever taken care of children, there are actually very few trials which involve pregnant women anyway. We don't usually involve them. And actually in the Pfizer vaccine, there was a very small number of the vaccine found out they were pregnant, and actually they didn't have any problems later with that. So I will let you ask your questions, and I'd like to open the floor at the moment now. So back to you, Sharmeen.
Can you see us?
Yes, I can. Now I can.
Oh, that's fine.
Any questions so far?
We're just trying to take figure out how to work this all. Is it you can't try that? Okay, so I don't know how to get this. No. There, we've got it. Okay, so does anyone have any questions for Dr. Samira regarding the vaccine? Yeah, we've got a question from Fatima.
I'm just wondering if the vaccine would have side effects years later. Do you know anything about that?
So she asked, is the vaccine, do you have any side effects years later?
So the honest answer, Sister Fatima, we don't know because this is the first vaccine of its kind. So far, the first trials were only about when it all started. So I would say the data started pouring in around late last year, and so late 2020. And so far, alhamdulillah, no. But that's the case for almost every vaccine which has come out before.
Okay, so does anyone else have any questions? Okay, so are under 16s eligible for the vaccine at the moment?
Not yet.
Not yet.
But watch this space.
Yeah. Okay. Anyone else any questions? Yeah, Fatima?
Which one's the best? Which vaccine is the best recommended?
Okay, which vaccine would you recommend, especially for young people? Yeah. So out of all the vaccines.
So I would say, as you know, my entire family has received the whole mix of it. So as you can tell, my approach is take whatever you can get. And personally, I would say anyone is fine, really. I know that at one point we were avoiding giving AstraZeneca to those who are young, so young women below 30. But as more and more data comes out, that might change. My suggestion would be to follow the latest PHE recommendation, because that is actually one which that recommendation is made after various experts have convened and decided. But as you know, my brother, who's 27, 29, had the AstraZeneca vaccine. My husband is 33, had AstraZeneca. I had Pfizer. And Moderna's only just came out. So if my sister tomorrow my sister needs Moderna, I'd say go for it.
Oh, thank you. Any more questions? Yeah.
I have a question. So has everyone had their COVID vaccine?
Has everyone had you?
Whoever's had it, put your hands up.
A lot of people haven't had it. I think that's why they've come to this session. I think now they're going to make their mind up. I think they were just lacking that knowledge. I think that's why we had this session.
I think it's very difficult, Shamin, because the COVID vaccines this is the first time we've had a disease like COVID. This is the first time we're having vaccines like the COVID-19 vaccine. It's not an old vaccine that we know of. And there's so much of fake information, fake news out there that I think it can actually be quite frightening for people to try and make sense of it all. So what I would suggest is, and the same thing which I told my mom, is that go to trusted websites, the government websites. Don't be easily swayed by YouTube videos. And if there is anything which you're in doubt of, ask the specialist people. So just like how we wouldn't trust YouTube to give us advice if we are having a heart attack, similarly, you wouldn't trust YouTube to give us advice if we are worried about COVID for ourselves and our families.
Yeah, that's fine. Anything else? I think you've covered everything, and everyone's just asked, well, any worries they've had, concerns. I think you've covered everything.
Okay.
Oh,
All right.
so, thank you so much. Is there anything else you'd like to talk, Dr. Samira, or is this?
Yeah, I have a request. Please remember me and my families in your dua.
Yeah, of course, and stay with us. Yeah, thank you so much for your time. It was really appreciated. We really benefited a lot from it. Thank you.
Yeah, well, thank you, and it was a pleasure seeing you. Assalamu alaikum.
Okay.
From my point of view as well, Dr. Afzal, just want to extend thank you on behalf of Union of Muslim Organizations, and of course we've held number of awareness sessions right at the start of the pandemic where Dr. Adil was present. So I'm sure we've got a couple of more sessions, so we might trouble you to get booking from you sometime in September, but I'll let my staff organize that with you. But once again, your time has really been appreciated. I know you were in London, maybe relaxing with the family, so giving up your time on Friday, that's much appreciated, and Jazakallah khair for your contribution.
Oh, thank you, and Jazakallah khair to UMO really, because it's not easy, and I think as a community, it's really, mashallah, helpful, all the hard work which yourself are putting in as well as everyone else in the UMO team. So thank you.
Okay.
Assalamu alaikum.
Thank you. Assalamu alaikum. Bye.
Bye.